Hello, my name is Sasha Thomason, and I have the pleasure of serving as the Animal Facilities Inspection Program Director for the Kansas Department of Agriculture. I appreciate you taking the time today for this webinar. For the next 60 minutes, we will be focusing on diseases of public health importance in pet animal facilities. This is important to KDA license holders because these diseases can all be passed to humans by the animals in these facilities, whether those humans are the animal caretakers or the new pet owner, etc. A few housekeeping items. So before we begin the session, the presentation portion of this session, all participant microphones will be muted by the meeting host. If you have a question during the presentation, please submit your question using the chat button at the bottom of your screen. KDA staff will be monitoring the chat for questions to be asked at the conclusion of the presentation. Lastly, this session is being recorded and will be posted online sometime next week or by the end of next week. And now I'd like to introduce Dr. Erin Petro. She is a state public health veterinarian at the Kansas Department of Health and Environment. In this role, she oversees rabies and zoonotic disease public health surveillance within Kansas, including consulting with and advising program staff, healthcare professionals, veterinarians, livestock and companion animal owners, and the public on various aspects of rabies, vector-borne, and zoonotic disease transmissions and control strategies. Prior to joining KDHE, Dr. Petro was in a mixed animal practice in rural southeast Minnesota. Dr. Petro, I'll turn it over to you.
All right, well, thank you. I am very happy to be back with you guys today talking about zoonotic diseases in dogs and cats and cover some of the diseases that we didn't get to last time. All right, so we're going to talk briefly about how zoonotic diseases are spread from animals to people. I'm going to go into some specific diseases of concern in breeding and shelter animal populations, and then we're going to cover some infection control practices to prevent these infections. So as a quick recap, I want to start with defining what zoonotic diseases are. Zoonotic diseases are infectious diseases that can be spread between people and animals. So it's not only the diseases that animals can give you, but also those diseases that you can pass to your animals. And one thing that I always like to remind people is that zoonotic diseases are actually very common. About 6 out of 10 of our established human pathogens, so circulating diseases in humans today, are zoonotic in origin, and about 3/4 of our emerging pathogens have a zoonotic origin. There are several ways that people can be exposed to zoonotic pathogens, but 3 major routes are contact transmission, which I've broken down into direct and indirect contact, vector-borne transmission, and respiratory transmission through aerosols and droplets. The routes of transmission are especially important to remember when we start talking about preventing zoonotic infections. So here on the slide, I've listed some common zoonotic diseases. And if you attended the webinar in October, you may remember that we covered the diseases in gray. Today, we're going to go in depth on some of the others, which I've highlighted in blue. Many of these pathogens have been documented multiple times as causing disease in veterinary professionals, animal owners, breeders, and others involved in the care of animals. So they're really important and, again, much more common than you may realize. So the first disease that I want to talk about is campylobacteriosis, which is a diarrheal illness caused by the bacterium Campylobacter. There are several species of Campylobacter associated with intestinal disease in both humans and animals, but Campylobacter jejuni is responsible for more than 90% of cases in humans worldwide. While the bacteria are present naturally in the gastrointestinal tract of different animal species, more than 80% of human cases of Campylobacter are due to eating raw or undercooked poultry, primarily chicken. And in fact, Campylobacteriosis is the #1 cause of foodborne illness in the US and is responsible for 1.87 million cases of foodborne illness each year. And while poultry are the most significant source of illness for humans, as you can see in the figure on the slide, there are numerous transmission pathways in which people and animals can be infected. So we can have direct contact with infected animals' feces, including wild animals and domestic livestock and poultry, and even our companion animals. consumption of raw or undercooked meat or unpasteurized milk, consumption of contaminated water sources, and we can even see transmission happening from person to person. So now let's take a look at Campylobacter in companion animals. Diarrhea is typically going to be the most common clinical sign in our young puppies and kittens 6 months of age and less. It's typically going to be an acute onset diarrhea that can last anywhere from 1 to 2 weeks. And during this time period, you may notice that feces are watery to bloody. You might see mucus in it, and occasionally it's going to be stained with bile, so it might have that yellow tint to it. Occasionally, diarrhea does become chronic and may be accompanied by systemic illness, including fever. And additionally, we have seen Campylobacter jejuni isolated from the vaginal discharge of late pregnancy abortions in dogs. Now, one important thing to remember is that some infected dogs and cats show no clinical signs of illness. These inapparent carriers still shed the bacteria in their feces and can spread it to other animals and people. And in fact, these healthy animal carriers are the ones that really pose a serious public health risk. As I alluded to on the previous slide, Campylobacter species are transmitted in numerous routes, including via contaminated food and water, the fecal-oral route, fomite transmission from humans carrying the bacteria on their shoes or clothing, and other shared items that we see like food and water bowls. And like their owners, dogs and cats can also be infected when they ingest undercooked poultry. Diagnosis is pretty straightforward and can be accomplished through fecal culture or PCR. And when it comes to treatment, we as an industry really need to shift our mindset. Most animals can be treated with supportive care, including fasting for 24 hours, feeding a bland diet, and the use of probiotics. When we get into systemic illness, that's when we need to be reaching for antibiotics. So this would be fever, severe blood work change, or prolonged illness. However, antibiotics shouldn't be the first thing that we're reaching for. And what we really don't want to see is antibiotics as a part of a protocol in animals that are just moving or that are coming into a new environment that are not having diarrheal illness. And even animals that are treated with antibiotics can remain colonized and become persistent Campylobacter shedders despite treatments. So if the goal of treatment is to decrease the risk of zoonotic transmission to, say, a susceptible household member, we can't rely on antimicrobial treatment alone, and instead, measures should be focused on infection prevention and control. Control involves removal of the patient to a clean environment and prospective fecal testing to look at that shedding status, but nevertheless, low infective doses and the ubiquitous distribution of the organism do pose substantial challenges. So now let's look at the human side of things. Campylobacter jejuni, again, is the most common cause of bacterial diarrheal illness in humans and results in nearly 2 million illnesses in the US each year. Again, that most common source is going to be undercooked poultry or cross-contamination from poultry. So cross-contamination often results from improper cooking practices, like using the same cutting board to cut up chicken breast and then using that cutting board without properly washing it to cut up vegetables that you may be eating raw or that aren't cooked to an internal temperature of 165 degrees. Now, one of the reasons that Campylobacter is so common is because it has such a low infectious dose. And in fact, even 1 drop of contaminated poultry juice can cause infection in people. In humans, illness is characterized by diarrhea, fever, and abdominal cramping. And again, for people, we're really leaning on supportive care for treatment and really only reaching for those antibiotics in the case of systemic illness or severe disease. So you might be wondering why I keep talking about not really leaning on antibiotics as heavily as we have in the past. And it's because of this huge multi-state, decades-long outbreak that we've seen in multi-drug resistant Campylobacter associated with pet store puppies. Campylobacter is a serious pathogen in the pet store puppy industry, and these extensively drug-resistant infections have been associated with pet store puppies since 2016, which is what I have shown here on the slide. These illnesses are especially problematic because the bacteria are resistant to our commonly used antibiotics. So when we do have severe illness, this can result in longer hospital stays for people, more visits to healthcare providers, and ultimately more costly treatment. Looking specifically at cases from outbreak A and outbreak B on the slide, 97% of cases reported contact with a dog in the week before becoming ill. And among those with additional information, so when we get these cases, we go back and do another interview to try to get more information. So not all of them have that available. But of the ones with additional information that was available, 78% reported contact with a pet store puppy, and 7% reported contact with a puppy from another setting, such as a shelter or a breeder. Among those with contact pet store puppies, 61% were pet store customers, 32% were store employees, so we're seeing this as an occupational risk as well. 4% were pet store visitors, and then 3% had contact with a pet store puppy that was actually purchased by someone else. Some of the associated puppies showed signs of illness like diarrhea, but importantly, some of those puppies also appeared healthy. However, this outbreak again doesn't stop with the two major outbreaks on the previous slide. Further genetic sequencing of past isolates indicate that this drug-resistant strain has been circulating since at least 2011. Altogether, as of June 30th, 2023, we've seen 247 human illnesses identified in 27 states, resulting in 4 hospitalizations. This map shows the distribution of those cases from the previous slide and is from a paper in 2021, which shows cases of illness associated with this large decade-plus multi-state outbreak. In Kansas, we've had 2 confirmed cases of illness in humans and isolated that strain from both a pet store and a breeder in Kansas. So with this persistent outbreak, what can you do to combat it? One of the most effective and important measures to take to prevent infections in both humans and animals is hand washing. It sounds simple, but effective hand washing with soap and water for at least 20 seconds at key time points, which would be after animal contact, after handling food products, and after cleaning up after animals. Along these lines, improving hygiene in breeding, transportation, and puppy stores is also key. Campylobacter can persist in feces for long periods of time, and even when conditions aren't great for the bacteria to survive, it can go into another state where once it's ingested, it again becomes infectious. So cleaning up messes when they happen and keeping facilities clean is really important. This means implementing specific infection control measures in your facility to ensure that cleaning and disinfection is happening regularly. And finally, as I discussed, we as an industry need to stop giving antibiotics unnecessarily. The research team that looked at this decade-long outbreak had difficulty getting details on antimicrobial administration in the pet sales industry, but they did express concern that antimicrobial products are being administered to dogs as part of store protocols rather than in consultation with veterinarians following evaluation. They recommended that the commercial dog industry implement measures to curb unnecessary antibiotic use and improve hygiene and infection control at all levels, from breeding facility to pet store, similar to those that we've seen by the food animal production industry in recent years. And I also want to say that as a veterinarian, we really need to embrace not treating with antibiotics for diarrheal illness at the first sign of diarrhea. We can get really effective results from bland diets, probiotics, and appropriate nursing care. So moving on to the next disease, I actually want to start with a case example and see if you all have any guesses as to what the pathogen might be. So in August of 2022, a pregnant 2-year-old indoor-outdoor cat was brought to a veterinary clinic in Northwest Kansas with an ulcerated lesion on her distal paw thought to be from a cat bite. She was initially treated with Clavamox, but the wound worsened over the next month and additional ulcerated lesions developed along the rest of the forelimb. This photo was taken soon after the cat presented for treatment. And as you can see, she's got some pretty serious wounds there on her paw and up near the elbow, and then on the upper limb there. The cat's sedated during this picture. And when the cat didn't improve, the veterinarian performed diagnostics to determine what the cat had, but I'm going to save that for the end. Treatment was initiated, which consisted of giving the cat oral medication by mouth daily, and then performing daily or every other day bandage changes with the cat sedated. The cat improved with treatment and gave birth to 2 healthy kittens in September of 2022. At that time, the cat was discharged home to her owner to finish up the treatment course. Unfortunately, the lesions reappeared after about 1 month, and this time began to extend up the limb. Treatment was adjusted to include an additional medication and resume those daily to every other day bandage changes. During one of these bandage changes, the veterinary technician was poked by the cat's nail. The technician immediately cleaned out the wound and it had healed completely within 1 week. Unfortunately, despite treatment, the lesions continued to worsen on the cat and spread to her other 3 limbs, so she was humanely euthanized in October of 2022. Around this same time, the veterinary technician started developing a wound from the previous puncture site. In about December timeframe, the owners reported that a second cat on the property had wounds on its face similar to the first cat's, and that second cat was found deceased. Additionally, the wound on the technician's finger became larger, developed redness around the wound, and had a small hole in the center. Moving into January, the technician's wound on her finger continued to get worse despite treatment from a local doctor. In February 2023, another indoor-outdoor cat from the same property was brought to the veterinary clinic with similar lesions. This cat underwent a 4-month treatment and those lesions did heal. Meanwhile, the veterinary technician with the finger wound was not improving and now had enlarged lymph nodes going up her arm all the way to her armpit. The veterinarian was concerned about the technician, so she actually reached out to the CDC for a consult regarding her technician. When the technician received the email, when the CDC received the email from the veterinarian, they reached out to us at KDHE to see if we were aware of the situation. And we were not at that time. So after we became aware of it, we coordinated a call with the CDC, the veterinary clinic, and ourselves to try to help this technician get appropriate diagnostics and treatment. All right, does anybody have any guesses of what this pathogen might be? MRSA? No. That's a good guess, though. Okay, not seeing any more. I'll continue. Oh, Sporothrix. Good job, Sasha. So, yep, this agent that we were dealing with was Sporothrix shankii, which causes sporotrichosis in humans and is also known as Rose Gardner's disease. Sporothrix is a fungal pathogen that is commonly found in the environment, and it does cause illness in people as well as animals, primarily dogs and cats, but it's also been reported from horses, cows, camels, rodents, and even dolphins. People and animals become infected when the fungus, which is found on rose bushes, hay, and sphagnum moss, is inoculated into the skin. So, for instance, if a person is poked with a rose thorn, that thorn inoculates the fungus into the body and causes infection. And in the case of our veterinary technician, the fungus was present on the cat's nail. And when the technician was poked during one of those bandage changes, the fungus was inoculated into her finger. And she was actually wearing gloves. It just poked through the glove. So pretty interesting there. Treatment consists of antifungal medication itraconazole for at least 1 month beyond apparent clinical cure and often requires greater than 12 months of treatment in cats. So it can be this really prolonged course of illness. Now, the weird thing about this case is that it took such a dramatic course in these cats, being fatal in 2 of the cats and was transmitted very easily to the veterinary technician, which is something that we don't normally see with Sporothrix shankii. It's definitely been documented, especially from cat to human, but it's really not thought to be all that common with this species. So our concern was actually about an exotic species introduction into the United States, Sporothrix brasiliensis, which has really taken off in Brazil in the last decade or so. And I'm going to talk a little bit more about that on the next slide. So because of the zoonotic potential, infection prevention is really critical with cases of sporotrichosis. This includes using PPE when handling infected animals, especially gloves, and then also protective outerwear like a gown so that you're not transmitting it from an infected animal to your next patient. You'll also want to isolate infected animals while they're being treated and then have that thorough environmental cleaning to prevent fomite transmission to other animals and people. And then again, really good hand hygiene. A colleague of mine was investigating a sporotrichosis outbreak among cats in a veterinary clinic, and it was being transmitted from using the facial mask for anesthesia. So that's why we really want to talk about that environmental cleaning as an important aspect of infection control as well. So this is the species of sporotrichosis that we've really seen become a major zoonotic risk in Brazil, Sporothrix brasiliensis. This species is much more aggressive. Cats often present with lesions on their faces, often around their nose, and then these lesions develop from wounds that occur during fights with another infected cat. Sporothrix brasiliensis can spread directly from an infected animal to a person or to other animals via the bite or scratch of that infected animal. And epidemiologic information from Brazil shows that caretakers of infected cats were 4 times more likely than others living in the same household to become infected. So you can see it's really an aggressive species that passes from cats to people pretty easily. There's also been infections from cats to humans reported without evidence of trauma like a bite or a scratch wound. So you might be wondering why I'm discussing this if we're primarily seeing outbreaks in Brazil. And that's because there have been a number of cases in both cats and people globally that have resulted because of the importation of sick cats and then subsequent spread. So I read about this really well-documented case series from the UK, where 3 human infections resulted after being scratched by a cat that was imported from Brazil with the family 3 years prior. So this family came over to the UK from Brazil. They brought their cat with them. The cat was apparently healthy for a long time and then started developing lesions, which persisted for months. They did take the cat to the veterinarian, and the cat was started on treatment. They did diagnostics that were suggestive of sporothrix, but I don't know that it was really on the top of their differential. And unfortunately, the cat did pass away. When the cat was being treated by its owner, it scratched the owner. That owner developed sporothrix. And then it also scratched a child that was in the household who developed sporothrix. And then the veterinarian was bitten by the cat when they were initially examining it. And that veterinarian also developed sporothrix. So this cluster demonstrates cat-associated sporotrichosis and really illustrates it as a growing global public health concern. Okay, so now we'll move on to the next disease, and the next one I'm going to talk about is tularemia. Tularemia can be a zoonotic disease or a vector-borne disease caused by the bacterium Francisella tularensis. Oh, I'm sorry, Crystal, I just saw your question. Yes, it was diagnosed by an impression smear under the microscope. So that's what the picture of the sporothrix was. Okay, back to tularemia, vector-borne, caused by Francisella tularensis, and it can infect both animals and people. And again, it does not require very much to cause infection. It's got a very low infectious dose, so about 10 bacteria is enough to cause infection in people and animals. And it's really unique in that it can be transmitted by various routes, as I have shown here on the slide. So we've got deer fly and tick bite, which is one of the more common routes of exposure that we see here in Kansas, in people at least. We don't have great information on epidemiology in animals. Being bitten by an infected cat is another major route of transmission in humans that we've seen over the past few years. But there are several other ways that a person or animal can be exposed to tularemia, including handling infected animals, so like skinning infected rabbits or other rodents, inhaling dust or aerosols that are contaminated with tularemia. We actually saw a cluster of human cases in the late fall of last year that were associated with yard work. So that could be a person accidentally mowing over a carcass or something like that when they're doing yard work. And then consuming contaminated food and water is another potential source of exposure. And then our clinical presentation that we're going to see in both humans and animals is going to vary depending on that route of exposure. Okay, so there are over 250 species of wild and domestic mammals, birds, reptiles, and even fish that can become infected with tularemia. So it's very opportunistic. It will infect whatever it can in whatever way it wants to. And from what we read in the literature, cats are at a higher risk than many other domestic animals due to their predatory behavior. Cats also appear to have a greater susceptibility than other domesticated animals. On the other hand, dogs appear to be relatively resistant to the bacteria, and infections in dogs is reported to be rare. However, I will say that since dogs tend to experience less severe illness in cats, there's a real strong possibility that infections in dogs are just going underdiagnosed. And in fact, we just had 2 dogs reported with tularemia in Kansas last week. And interestingly, during that same week, we had 3 cats that were reported, and we just had another cat today. So it's definitely out there and entering its season of transmission. Again, clinical signs are going to vary depending on the species of animal, but also on the species of tularemia, and importantly, on the route of exposure. So dogs and cats can become infected with tularemia, again, in the same way that people do, but in companion animals, tick bites and eating dead animals are going to be the most important routes of exposure. In most mammals, sign of illness can include tick infestation, the sudden onset of a high fever, swollen lymph nodes, lethargy, and a poor appetite. Other signs might include stiffness or reduced mobility, and that would be associated with a more generalized infection. Sometimes if they have pulmonary infection, they might have a cough. We can see diarrhea and some other symptoms as well. On the other hand, there are also animals that experience very mild illness, so those symptoms might not be noticed at all, and it might go undiagnosed. Diagnosis of tularemia is highly dependent on clinical suspicion, but it's relatively straightforward. So depending on the clinical signs, a sample can be taken, such as from an enlarged lymph node or from an oral or throat swab, and then confirmed by bacterial culture or PCR. We're seeing used a lot as well. You can do serologic testing in animals, but that's not really something that I see commonly. Tularemia is very susceptible to our common antibiotics like doxycycline, and antimicrobial treatment, if begun early, is very highly effective. Once started on appropriate antibiotics, these animals usually start to improve within about 24 hours, and then they do develop lifelong immunity after becoming infected. So when we think about the ways that animals are infected, we can identify some really effective prevention measures as well. So keeping animals on flea and tick preventive every month year round, not allowing animals to hunt or eat rabbits, and then using good fly control. We saw a cluster of cases in animals last year that was in an area that had a really high fly population, and that was kind of how we suspected that it was being transmitted between these different animals. So I have a case report to go with this one as well. I think it's a pretty interesting one. On May 19th, KDHE was notified by a local health department of a cat that tested positive for rabbit fever, and reports from the cat owner and the vet clinic staff of illness. So we began our investigation. First, we contacted the treating veterinarian who stated that the owner brought the cat in on 5/10 with a prolonged seizure. The veterinarian treated with a dose of diazepam, and the cat stabilized. This was a 10-month-old indoor-outdoor cat that had no previous history of veterinary care or vaccination. On exam, the veterinarian found a puncture wound at the base of the ear with a firm subcutaneous lump starting at the base of the ear and extending down. The cat continued to be lethargic and was placed on IV fluids and IV metronidazole. Around noon the next day, the cat started having tremors and died. Suspecting rabies, the veterinarian removed the head to send it off for rabies testing, and at that time saw just how far down the mass at the base of the ear extended, so she decided to do a full necropsy. The veterinarian wore a surgical mask and gloves during the necropsy, but the veterinary technician who assisted with the necropsy did not wear any PPE. 4 days after assisting with the necropsy, the veterinary technician became ill with fever, muscle pain, joint pain, and vomiting. A chest CT also showed lung lesions. The vet tech was started on diarrhea and made a full recovery. The vet tech denied being bitten or scratched by the cat while caring for it. And in talking with the cat owner, around May 6th, the cat disappeared, and they didn't see it for about 3 days until it returned home on 5/9 and seemed very sick. The cat was falling over and seemed lethargic, and it also had more fleas on it than the owner said they had ever seen. In mid-June, about a month after the necropsy was performed, the vet tech's tularemia test came back positive with a titer of 1 to 2056. And just for reference, a positive titer is 1 to 160. So a really high titer in that vet tech indicating that it was confirmed to be tularemia. When they initially went to the doctor, they were not tested for tularemia. So this case just really shows how even when there's not an apparent direct exposure, like being bitten or scratched by that cat, the fact that the tech was participating in the necropsy without using appropriate PPE, This cat was open. It had lesions on the base of its neck, its spleen, its liver. It was highly infected with tularemia, and we know that it has a low infectious dose. So potentially aerosol exposure, being that there was a pulmonary infection in this technician. So Kansas is a high incidence state for tularemia. So I do want to spend a little extra time here discussing prevention measures in humans as well. Untreated tularemia has a case fatality rate of about 30% in people, which is really high. And because it can take on so many different clinical presentations, it can be challenging for providers to diagnose. So preventing is really important. Since tick bites are a main route of transmission, we really want to focus on our general insect precautions. So using an EPA-approved insect repellent on exposed skin, that would be something like DEET, oil of lemon eucalyptus, or picaridin. Wearing long sleeves and long pants when you're in these tick habitats, and then performing tick checks after being outdoors and promptly removing any attached ticks. It's also really important that if you start feeling ill after a tick bite, you tell your provider that you were bitten by a tick. We also want people to use caution when they're mowing or landscaping. You should never mow over sick or dead animals. And it's a good idea to check the area for carcasses prior to mowing or brush hogging if it's going to be like high grass where you can't necessarily see. And if it's especially dry or dusty, we do recommend wearing a mask because we, again, saw cases associated with lawn work last year, especially in those dry, dusty conditions. And then finally, using caution when hunting and trapping and skinning animals, since they are a known reservoir and that's a source of infection for people. All right, so switching to our next topic, we have zoonotic influenza, which are influenza viruses that can be spread between people and animals. And I first want to start by acknowledging just how much variety there is in influenza viruses. So it can get pretty confusing when we start talking about these different influenzas. And there are actually 4 different types of influenza virus, A, B, C, and D. A is the one that I'm going to be focusing on today, but I just wanted to mention the others in case you have heard of them or they come up. Type B influenza is typically going to be less severe than type A and usually only infects humans. Type C generally causes no symptoms or only mild illness and is primarily a pathogen of people. And then type D influenza is our newest of the influenza viruses and historically primarily caused disease in cattle. So in the figure on the slide, you can see the natural host range of each of these influenza virus types and just how much overlap there is. I also want to point out here that pigs are the only species known to be infected by all 4 influenza virus types, which is why they are often referred to as the mixing vessel. And then finally, I want you to note that influenza A has the widest host range, which leads us into our most aggressive and noteworthy of our influenza viruses, influenza A. They are responsible for seasonal epidemics and all of our previous influenza pandemics. Because of their wide host range, influenza A viruses are called species jumpers, and for their ability to rapidly move between different host species, which is exactly what we've seen in the current avian influenza A panzootic. Because of all of these characteristics, zoonotic influenza ranks as the #1 U.S. priority zoonotic disease for One Health collaboration, meaning that human, domestic, and wildlife animal health sectors need to work together to prevent the transmission of influenza between people and animals and between animals of different species. So to understand why we were concerned about zoonotic influenza, we need to discuss spillover events. Spillover events occur when a pathogen, like influenza, is transmitted from one host species to another. As we discussed at the beginning of the presentation, several pathogens that infect humans are derived from other animal species. Conservative estimates indicate that around 60% of all emerging human infectious diseases are zoonotic. Others suggest that this is up to 75%. But regardless of the differences between these estimates, it's evident that most human infectious diseases have a zoonotic origin. In other words, these diseases originate from pathogens that were transmitted from non-human animals to humans through a process known as zoonotic spillover. So how does this happen? And I just want to say that I have simplified this process a lot on this slide. So it's not maybe as easy as it looks on the slide, but I just wanted to do that so that we can have a basic understanding of how this happens. So a spillover generally starts when some type of increased interaction between humans and animals that allows for the pathogen to pass from the infected animal to the person. From there, one of two things can happen. First, the pathogen can become host adapted to humans and be able to successfully replicate and then gain the ability to spread human to human. So this is what happened in the 2009 influenza pandemic that originated in pigs. It spread to people, and then it gained the ability to spread from human to human. And we got an pandemic. The second thing that can happen is that the pathogen does not adapt to the human host. And while that person can still be infected, they don't spread the infection to other people. So this would be something like what we've seen with the current avian influenza outbreak so far, in which people can be infected, but to this point has not host adapted to spread from person to person. So one important spillover event that occurred over the past couple of decades is the spillover of equine influenza into dogs. So when we think about increased interaction, this was first seen in racing greyhounds, which had increased interaction with and shared spaces with racing horses. H3N8 influenza was circulating in horses from horse to horse at the same time, and then at some point it infected a dog. Eventually, the virus gained the ability to transmit from dog to dog, and then we had sustained transmission between dogs, exclusively among racing greyhounds. And there was nothing special about racing greyhounds. They just were this secluded population that had a lot of contact and shared environments, which allowed the virus to circulate. And eventually the virus made its way into the pet dog population, and now we see it circulate among dogs across the country. And I also want to point out that once influenza viruses host adapt to their new host, they become genetically distinct from the virus that they originated from. So now 20 years out from this initial spillover event, we see distinct H3N8 in horses and in dogs. So they're not continuing to share that virus and infect each other. They each have their own circulating H3N8. So now let's talk briefly about canine influenza, also known as dog flu, which is a contagious respiratory disease of dogs. And again, I just wanted to point out that while this came from horses and it can infect other species, this really is a disease of dogs. There are two different subtypes of influenza A viruses of dogs. One is the H3N8 that we just discussed, and the other is H3N2. And as I mentioned, H3N8 did originate in horses. It was an equine influenza virus that underwent antigenic shift, gained the ability to infect dogs, and transmit efficiently from dog to dog. And then we also have our H3N2 strain, which was first seen in Asia in 2006-2007 timeframe. And in contrast, from H3N8, H3N2 likely jumped from poultry to dogs. It was first seen in the US in 2015, where it was involved in a large outbreak in Chicago. In May of 2017, canine H3N2 influenza was diagnosed in dogs in Florida, Georgia, North Carolina, and many other states. And currently, both strains of canine influenza are now found throughout the United States. There is no evidence that either strain of canine influenza can infect humans. However, we still do need to take those universal precautions when we're caring for animals with respiratory disease. Being a respiratory disease, canine influenza is transmitted through droplets or aerosols containing respiratory secretions from coughing, barking, and sneezing. Dogs in close contact with infected dogs in places such as kennels, groomers, doggy daycare facilities, and shelters are at an increased risk for infection. Canine influenza can also be spread indirectly through objects such as kennels, food and water bowls, collars and leashes, or people that have been in contact with infected dogs. So because of this, it's really important to clean and disinfect objects that have been in contact with an infected dog to avoid exposing other dogs to the virus. Likewise, people who have been in contact with an infected dog should wash their hands and clean their clothing to avoid spreading the virus around. Clinical signs typically appear 2 to 3 days, but sometimes up to 8 days after a dog has been exposed. And dogs are most contagious during the incubation period, and then they shed the virus even though they're not showing clinical signs of illness. Some dogs may actually show no signs of illness, but have a subclinical infection and continue to shed the virus. So these characteristics allow the virus to spread rapidly, especially in our high density populations. The majority of infected dogs exhibit a mild form of illness, which resembles kennel cough. The most common clinical sign is going to be a cough that is very persistent. It lasts about 10 to 21 days, despite treatment with antibiotics and cough suppressants. Affected dogs may also have a soft, moist cough or a dry cough that, again, is similar to that induced by kennel cough. In more severe infections, we can see nasal or ocular discharge, sometimes sneezing, lethargy, and anorexia can also be observed. And then many dogs will develop that purulent discharge like you see here in the picture and have a fever of about 104 to 105. That nasal discharge is usually caused by a secondary bacterial infection. Some dogs are more severely affected and exhibit clinical signs of pneumonia, like a high-grade fever of 104 to 106, and increased respiratory rate and effort. And although most dogs recover without incidents, we have had deaths reported due to H3N2. So overall, we're looking at a fairly high morbidity of 80% because most dogs have never been exposed to the virus. So we have a really large susceptible population unless they've been vaccinated, but a mortality rate that is less than 10%. When this outbreak originally started back in 2004, there was a lot higher mortality rate that was being reported. But then by the next year, that was down to about 6 to 8%. So again, for prevention, we have vaccination available for both strains of canine influenza. It's available in a bivalent vaccine. Vaccination is recommended based on the lifestyle of the dog. So do they board? Do they go to a doggy daycare? Do they get groomed, etc.? And while vaccination may not prevent infection, it does reduce the severity and duration of clinical illness. So to prevent this from spreading, again, we really want to lean on those infection control measures. This is going to be a recurrent theme throughout the presentation. Infection control is really, really important. The virus can remain viable on surfaces for up to 48 hours, on clothing for up to 24 hours, and even on our hands for up to 12 hours. So it's really important to wash your hands, implement those biosecurity protocols and disinfection procedures to reduce the risk of disease transmission. Employees should wash their hands before and after handling each dog, after coming into contact with dog's saliva, urine, feces, blood, after cleaning cages, of course, before eating, and importantly, before leaving for the end of the day so that they're not bringing any of that home to their own personal pets. Testing is available through Cornell, and actually they have a pretty good data visualization where they show the number of tests that have been performed and positive results. I did look for Kansas, but last week, I guess, to see if there were any influenza positives in Kansas, and there had not been, but there had only been 11 tests reported. So not a very good representation of our dog population. Do we have any idea of how effective the vaccines are and how commonly they are given? So I do not know how commonly they are given. That's a good question. I think it probably varies a lot. I think there's probably some practices where it's very common to give it. I know that at a practice in my area, it's required for all dogs that are there for grooming and then recommended for dogs that are boarding a lot. As far as how effective they are, I do not have those numbers, but again, from what I've read, they are very effective at preventing severe illness and preventing outbreaks. That's something, though, that I can look up and get back to you. I can let Sasha know and she can reach out to you for that because it's pretty interesting to think about. So our next spillover event is in cats. There have been several recent spillovers into cats. And so the first one that I am going to talk about was in 2016 when the canine influenza A H3N2 strain infected cats in a shelter in Indiana. This virus did spread cat to cat through direct contact. So that can be like playing or sleeping together, licking, nuzzling. And then it can also be transmitted through our respiratory route. So droplets made from coughing or sneezing or that nasal discharge. And then via contaminated surfaces, again, like our shared food and water bowls or cage surfaces. The second spillover event was later in the year in 2016 when influenza A H7N2 caused an outbreak in a shelter in New York City. This influenza virus was from an avian origin influenza. It infected a cat and then gained the ability to spread cat to cat in this shelter. And this was actually a fairly large outbreak with over 100 cats testing positive. There was also a human that was infected from a cat during this outbreak. The associated human infection was in a person who had close, prolonged, unprotected exposure to the respiratory secretions of infected sick cats. The person did have relatively mild illness and recovered, but this case serves as a great reminder to wear appropriate PPE when handling sick animals. We don't know what these animals might have, and so when we're initially evaluating them, we should treat them all as if they might have something that's potentially an infectious zoonotic disease. So really embracing that concept of universal precautions. So with an animal with respiratory disease, this would mean wearing gloves, ideally a gown, but it can also be another protective outerwear like a lab coat, mask, and eye protection when examining animals that are sneezing or coughing, or if, like, say, a veterinarian is going to be obtaining a diagnostic sample that might cause the patient to sneeze or cough, like a nasal swab or an oropharyngeal swab, because we really want to prevent that transmission of the virus onto our mucous membranes. Okay, so the final influenza spillover that I wanted to discuss is this currently circulating avian influenza A H5N1 virus that has spilled over into more than 200 different animal species. As you may have heard, there's been a fair amount of news in the past few months regarding domestic cats and HPAI. According to USDA data, as of April 23rd, there have been 136 cats confirmed positive with H5, including 5 in Kansas. And I will say this is probably a pretty significant undercount of just the 5 cases that I'm aware of in Kansas. In almost every one of those cases, there has been more than 1 cat that's been affected, but only 1 cat was sent in for testing. So this really only represents those cats that were tested, not necessarily the other ones that were ill. Deaths and illnesses of cats due to HPAI are not a new phenomenon, but we are recognizing different ways in which these animals are becoming infected. So early in this epizootic, domestic cat deaths were associated with eating infected wild birds, but after the spillover into cattle, we saw dozens of cats on these farms dying due to HPAI contracted from ingesting raw milk. More recently, cat infections and deaths have been linked to eating commercial raw pet foods. We've also started to get reports of cats with no known exposure source identified. While most of these have been in outdoor or indoor-outdoor cats that were likely preying on wild birds, there were some recent cases that were published that suggested fomite transmission and cat-to-cat transmission in 2 indoor-only cats. So what's really concerning about this infection in cats is that we're seeing some pretty severe illness. Typically, we see one of 2 forms. The first is a neurologic illness that really mimics rabies in presentation. We see cats walking like they're drunk, having hind limb weakness. They appear to be blind. They have seizures. These cats rapidly progress, and it's almost always fatal within about 24 hours. The other major kind of course of clinical illness that we're seeing in cats is more of a respiratory illness. So these cats have a high fever, they're lethargic, anorexic, and they have this nasal ocular discharge. I will say of the cats that I know of that have recovered, they've had the respiratory form of illness. Raw pet food, as I mentioned, has also become a major source of infection for domestic cats. As of March 15th, the Food and Drug Administration had issued 3 recalls of commercial raw pet food, which had been associated with cat deaths and illnesses in multiple states. The most recent recall involved Savage pet food, which was to date has been the most widely distributed product. The affected products were also distributed to Kansas. So as a result, the Kansas Department of Agriculture issued an alert on March 25th, notifying veterinarians of this new health risk. And because of the many recognized health concerns, including HPAI, the American Veterinary Medical Association strongly advises against feeding raw pet foods, and even those freeze-dried treats, they're not being cooked to a temperature that would destroy HPAI or many other pathogens. All right, so check my time. I'll speed talk on this one. It's really interesting though. Moving on to our next pathogen, we have leptospirosis. Lepto is a zoonotic disease with a worldwide distribution and is caused by infection with any of our several pathogenic serovars of Leptospira. The disease affects virtually all mammals and is maintained in nature through chronic kidney infection of carrier animals. Commonly, this is going to be rats, dogs, cats, horses, sheep, not cats, sorry, cattle, sheep, goats, and pigs. These animals can shed Leptospira in their urine for years, And when it comes to zoonotic concern, dogs and rats are probably the more common source of human infection. Regarding transmission, leptospirosis is most common in warm tropical areas and is seen there year-round. In temperate areas like Kansas, the disease is more seasonal, and we see the highest incidence after periods of rainfall, especially heavy rain and flooding. We can see transmission in various routes among animals, and here's where things get a little bit tricky. So there are maintenance hosts and there are incidental hosts with the different serovars of leptospirosis. So if we liken it to influenza, we can think about birds as the maintenance host for avian influenza. They pass the infection mostly among themselves, they have mild to no clinical signs, and it occasionally spills over to our incidental hosts like cats, where it causes severe disease and high mortality. When in the case of lepto, dogs can be both maintenance hosts and incidental hosts. When they're maintenance hosts, the bacteria doesn't cause as severe disease. There are a few bacteria that are disseminated to the different tissues in the body, but they get a persistent infection in the kidneys. They then spread the infection through direct contact with the infected urine, placental fluids, milk, or venereal transmission. However, when dogs are infected with a different serovar, that they are not the maintenance host, they're the incidental host, we start seeing severe clinical signs with bacteria disseminated throughout the body. So to tissues like the liver, a short phase of infection in the kidneys. And this type of transmission is usually through indirect contact, meaning areas that are contaminated with urine from infected wildlife animals. The bacteria then will enter the body through breaks in the skin or the mucous membrane. So like if an animal is swimming in a pond with lepto or it drinks water that's been contaminated with lepto, that's how they're becoming infected. So the clinical signs that you're going to see are going to depend on the serovar of infection. If it's one where the dog is the maintenance host, we see mild clinical infection or subclinical illness. If the dog is an incidental host, we see acute systemic febrile illness with kidney and liver damage. Often other organs can be infected, including the eye, so we can see a uveitis. Animals can get pancreatitis, a hemolytic anemia. They can have muscle pain, and it can even progress to respiratory disease. With both types of infection, if the animal is pregnant at the time of infection, we can see abortion, stillbirth, weak neonates, or birth of infected but apparently healthy pups. Regarding treatment, antimicrobial therapy is usually effective. However, that organ damage can be permanent. So vaccination is really a key component of prevention here. Commercial Bactrians for dogs are available for 4 major serovars in the US, and it's not really known whether vaccinated dogs are susceptible to infection with the other serovars that are not included in the vaccine component, but there is some experimental evidence that we do get cross protection. In general, currently available vaccines provide good protection from disease for at least 1 year, and they also reduce the colonization in the kidney, thus reducing urine shedding. Concerns exist regarding hypersensitivity reactions after vaccination in dogs. However, vaccination against Leptospira, which is an organism that can cause fatal disease, is safe in most cases, and studies have actually shown no significant increase in hypersensitivity reactions compared with other vaccinations. So we're looking at a really safe and effective vaccine. In October of 2023, the American College of Veterinary Internal Medicine issued an updated consensus statement on leptospirosis in dogs, recommending that the lepto vaccine should be administered annually. Excuse me. And should be administered annually to all dogs starting at 12 weeks of age, regardless of the breed. The consensus statement goes on to recommend that leptospirosis vaccine should be required for dogs to board or to enter a daycare facility. Sorry about that. So, as with animals, leptospirosis infection in humans occurs around the world, including throughout the United States. We see about 1 million cases in people occur globally each year, with nearly 60,000 deaths. People are incidental hosts and are infected in the same way as animals, which is through contact with the bacterium. And this can occur in a few ways. We can see contact with water or soil containing urine or body fluids from infected animals, especially after hurricanes, flooding, or heavy rainfall. Directly touching body fluids from an infected animal is another source of exposure, and then eating food or drinking water that is contaminated by the urine of an infected animal. It generally takes 2 days to 30 days to get sick after having contact with the bacteria that causes leptospirosis, and disease in people often occurs in 2 phases. In the first phase, people may have an influenza-like illness, so seeing that fever, chills, headache, muscle aches, some GI symptoms, and then they may feel better for a while and then become ill again in the second phase. The second phase is a much more severe illness with kidney and liver failure and inflammation of the membrane around the brain and spinal cord. The illness can last from a few days to several weeks, and without treatment, getting better can take several months and may result in death. So when we think about prevention in humans, there are 2 aspects to consider. First is recreational exposure to the bacterium, and this is usually through activities that put you in contact with water or moist soil. So this would include swimming, kayaking, canoeing, rafting, etc. in rivers, swamps, or creeks, hiking or hunting, gardening or yard work, or other outdoor maintenance that puts you in contact with moist soil. The second way that humans are exposed is through occupational exposure to infected animals. So jobs like working at a veterinary clinic, a wildlife rehabilitation center, cattle farming, or butchering are also recognized risks of exposure. It is rare for people to spread leptospirosis to other people. However, we have seen this in some situations for people experiencing homelessness or living in a shelter or other facility that has a real dense population. And then finally, I just wanted to go through quick prevention measures. We talked about this in depth last time, so I'm not going to go in depth today. I just wanted to provide this brief overview slide about our prevention measures that we can take. And then I also have some infection control resources here. There's some really great ones from different organizations that I'll leave you with. And then a few minutes left for questions if anybody has any. Sorry about my voice failing there at the end.
Thank you, Dr. Petro, for that. I want to go back to a question towards the top of the chat that asked about the outbreak at the pet store. With it, if you could just briefly let us know on that. And then I have one other question as we're getting ready to wrap up today.
Okay. So we do know where some of the pet stores got the puppies. That wasn't released publicly, though, as far as like the actual producers. It was associated with a pet store called Petland, but they did not talk about the specific producers, whether they were large producers, small producers. I assume it was probably a variety because it is pretty widespread.
And then, like I say, we just have a minute left, and a question came in to me directly on it regarding influenza. Have any dogs shown evidence that they can be infected by influenza in the recent HPAI outbreak?
So not in the United States, we haven't had any dogs infected, but in other countries, there have been dogs that have been infected.
All right. Sasha, I'll turn it back to you to wrap us up for today.
Okay. Well, I just wanted to thank Dr. Petro again for her time and expertise this afternoon, and everyone else have a good afternoon, and we'll see you at the next one. Thank you.